Thank you, Mr. Chairman. Thank you, Mr. Secretary. I would like to yield my 5 minutes to the person I think is the only member of this committee who's actually worked in a VA hospital, Mr. Baird of Washington State.
I thank Mr. Cooper. I would rarely ask for this, but I have to go to another markup. And having worked in a VA and specializing in traumatic brain injury, I really wanted to take a chance to ask you a few questions, if I might. And I want to respond to my good friend, the ranking member from Wisconsin, who asked about the 205 shortfall. A brief story about that is in order. I, along with my colleague, Ms. Hooley from Oregon, in late '04, began to ask our local psychologists and other health professionals at our regional VAs, do you have the resources you need currently to treat the current veterans? And with reasonable anticipation of certain incidence rates among the incoming returnees, have you plussed up your budget and staffing levels to meet that? The answer was deeply troubling. The first answer was, Congressman, if I tell you the truth, I will lose my job. That's a true story. Federal employees telling an elected representative of the people that if they told the truth, they'd lose their job. Secondly, the answer was absolutely not. We don't have enough to meet our current needs, and we don't have any projected increase proximal to what we're going to need. In response to that, Ms. Hooley and I tried to offer an amendment to the then emergency supplemental to add $1.5 billion, which we estimated and veterans groups estimated would close the anticipated gap. We were not allowed to offer that amendment when the supplemental came up, and the official administration position is you don't need to because we're going to meet the needs. 6 months later, sure enough, there was the shortfall revealed, as the Secretary said. So my first question, Mr. Secretary, and I know this may not have been on your watch initially because you came on right after that, but would you, without any hesitation, say that a staff member of a VA who responds honestly to a request for information from a member of Congress that does not violate confidentiality restrictions will not be subject to dismissal if they answer the question honestly?
I will unequivocally answer that and say absolutely not. One, because that's the way it ought to be, but two, it wouldn't even be possible to dismiss them. I mean, I have people that we were talking about these data breaches, some of which are pretty flagrant, and I find my hands very tied in taking discipline action against them for that, let alone someone that decides to speak his or her opinion.
Well, I will tell you.
That happens, by the way, all the time. I was just on this television special and had several members of the VA interviewed who had a view of some things different than I, and they were not a bit inhibited about saying.
Well, I will tell you, Mr. Secretary, I spoke to a half dozen PhDs, MDs, nurses, and others, all of whom gave me the same answer. So when your model falls short, perhaps the reason the model falls short in estimation is the people who are on the line providing the service are not included in that and they're intimidated. I'll just put that out there. Second question, that same issue arises, though, as we look at the current budget. As we look at the projected incidence of certain issues like traumatic brain injury, post-traumatic stress disorder, etc., you said earlier we have good capacity to meet post-traumatic stress disorder. I don't hear that from the people in the field. When you say good capacity, have you done incidence calculations in terms of what's the percentage of normal incidence of returnees and what capacity do we have to meet that? Because I'm not seeing that. I'm certainly not seeing it on the ground.
I'm going to ask Dr. Cussman to give you a more refined answer, but I will give you some numbers that of the returnees from the war. We have seen we see in the vicinity of 210,000 of those that have come back and have been separated. And of that number, I think it's 73,000 that we've screened have mental health issues. And in continuing the diagnosis that we do with those people, we've concluded that 39,000 of them should be in a treatment for post-traumatic stress disorder and are.
Well, let me, because I'm going to run out of time here, ask three things. Could you give me some more details about what it means to be in treatment for post-traumatic stress in terms of frequency of visits, waiting time to access that? That'd be question one. Question two would be, when you make your long-term cost projections, and I think Mr. Edwards was very articulate about this, having worked in TBI, that was my specialty area, was traumatic brain injury. Some of these folks are going to need long-term care and vocational rehab. They're going to need emotional support for their families. The data suggests people tend to have fairly positive recoveries, immediate post-injury. Then 4 or 5 years out is when things begin to fall apart for their families and themselves as the recovery rate has plateaued. So I'm interested in long-term costs for TBI. And then the final question I'd like, could you provide members of the committee some estimate of the additional cost to the VA system resulting from the Iraq conflict, just the Iraq conflict? And I'm not asking for that now, but I think when we hear the cost of this war, I'm very interested in what the additional cost of this system would be if we fully met the needs of the veterans for the projected future. In other words, the lifetime of the veterans. What's the full cost of this war going to be for that? And I thank the gentleman for yielding the time, and obviously I care passionately about this, having worked with our soldiers in the VA. Thank you.
We will attempt that, but I would like to be able to get with you to get some more particularity, what that would mean.